This is a person with perseveration. This patient repeatedly moves forward and backward through a doorway despite no apparent reason to continue the action, comma. This is an example of motor perseveration, where a motor activity is repeatedly performed even when it is no longer appropriate. Perseveration is the inappropriate repetition or continuation of a response, behavior, thought, word, or action after the original stimulus has ceased. It reflects an inability to shift from a previous mental set or motor program to a new one. Types of perseveration, motor perseveration. Repetition of a movement or action, comma. Example, repeatedly walking through a doorway, repeatedly opening and closing a door, or continuing to draw the same shape. Verbal perseveration, repetition of words, phrases, or responses, comma. Example, giving the same answer to different questions. Ideational, cognitive, perseveration. Persistent recurrence of the same thought or idea, despite a change in topic or context. Neuroanatomical basis. Perseveration is commonly associated with dysfunction of the frontal lobes, particularly dorsolateral prefrontal cortex, orbitofrontal cortex, fronto-subcortical circuits involving the basal ganglia. These regions are responsible for executive functions such as cognitive flexibility, response inhibition, task switching, behavioral control. Causes. Perseveration may occur in frontal lobe stroke, dementia, especially frontotemporal dementia and advanced Alzheimer's disease, Parkinson disease, progressive supranuclear palsy, corticobasal degeneration, Creutzfeldt-Jakob disease, traumatic brain injury, brain tumors affecting frontal networks, delirium and severe encephalopathy. Clinical assessment. Bedside tests include, comma, asking the patient to alternate between drawing a circle and a square. Luria's three-step motor sequence, fist-edge palm test, dot. Verbal fluency tasks. Alternating hand movements, comma. The patient may continue the previous response despite instructions to change. Clinical significance. Perseveration is a sign of executive dysfunction and often indicates impairment of frontal lobe or frontal subcortical circuits in a patient with cognitive decline, gait abnormalities, behavioral changes, or Parkinsonism. The presence of perseveration should raise suspicion for a neurodegenerative or structural disorder affecting the frontal lobes.